Aging cannot be separated from the rest of our lives. With the recognition that aging is indeed a part of life, social scientists, biomedical scientists, behavioral scientists, and followers of culture are deeply engaged in the study of aging. This has not been true for many psychoanalysts or for many psychoanalytical societies. Thus, the International Psychoanalytic Association has made a commitment to address this gap and set up a committee for psychoanalytic perspectives on the aging of patients and psychoanalysts. With this video, the IPA Committee on Aging would like to bring change and a new focus on aging from the unique psychoanalytic perspective. With this end in view, Dr Valeria Egidi Morpurgo, a full member of the Italian Psychoanalytical Society, went to ask the president of the IPA, Professor Stefano Bolognini, how he thinks analysts and their societies can and should approach the issues of aging. Her questions reflect her own views of the issues she raises.
We are in Stefano Bolognini's practice in Bologna. I have some questions about aging. Aging in Western societies. In Western societies, the current rate of aging is such that for every 10 0 to 14-year-olds, we now have 15 over 65-year-old people. How should we view growing old and old age today?
I think we should adequate our view of old age today to the huge changes which happened during these last years at a cultural, social and more widely human level. Since old age is no longer a difficult part of the life only, it is a part of the life where a patrimony of capacities, of experiences and skills are bigger than before. And this is the new way people, not only psychoanalysts, look at old age today.
Aging and psychoanalysis. A few well-known psychoanalysts have highlighted some aspects of aging. Daniel Quinault places an emphasis on becoming wiser and more tolerant.
Yes, I like very much this observation by Daniel Quinault because it corresponds to the new valorization of this age, also in the context of the family. And I could add also in the psychoanalytic practice and view. That is that today also the figures of grandparents have their own importance in the life of people. And this is important both for the patients who can meet an older, a very older analyst, a much older analyst, or for the analysts who can meet an older patient. The transferences can be very complex, and even if transference will recreate different complex scenarios, we feel confident that also the figure of the grandparents to two directions will be considered more and more in the future treatments.
Margarete Mitscherlich-Nielsen places an emphasis on being free to speak one's mind in anti-conformist ways.
This is a fascinating opportunity of old age. Old people are much more free-minded and open-minded because thanks to their experience, they can look at the human facts and vicissitudes with a more detached and experienced way. There is more humor in many old people. There is a capacity for concern to younger people, and there is an anti-conformistic view among them regarding a lot of matters. We have wonderful examples for many years from important intellectuals, but also from common people who are able to surprise their interlocutors with their free-minded attitude. And this is a gift of the older age.
The authors of the book The Empty Couch stress the needing to address the limitations imposed by physical decline, bereavement, and separations that growing old forces us to face up to. In fact, the book The Empty Couch places an emphasis on maintaining the good object.
Yes, I think this is an important achievement of the analysts who wrote this book. They pointed out how this capacity is important and how it can increase the human relationship capacity of older people when relating to other human beings. I think that the life, the experience, allow people to better distinguish what is good and what is bad, what is vital and what is deadly. And older people have a special capacity for distinguishing these qualities in the relationship and in the events of their life.
The IPA. Let us now turn to the topic of the IPA. As President of the International Psychoanalytic Association, how do you feel about the work carried out in last few years on the aging of analysts and their patients?
I think that the creation of the Aging Analysts Committee, analysts and patients, was a very important event for IPA. It enlarges a lot of activities, not only speaking about the treatment of older patients, but also examining the special technical problems which are presented in the different ages of the analyst. The analyst's experience, reactions, feelings, perspectives, style, which vary during the many years of activity of an analyst. The major concern for the IPA administration is connected to the risk of an aging of the average of the candidate's age. We wouldn't like to have a range of two aged candidates. And this is a problem because the societies have to take into account in their educational process the real time for creating a new analyst.
Whether psychoanalytical research and psychoanalytical training?
Yes, while research is going ahead brilliantly, thanks to the studies which are developed by several psychoanalysts engaged in this field, training is a more general issue which involves all societies. The societies are now facing the issue not to make longer the training in order not to have too old young analysts, institutionally young but older for age. we think that the societies have to reflect on their training methods, preserving the seriousness and availability of their training, but at the same time creating a possible path where the young analyst can progress correctly, but also directly to his or her qualification.
Finally, would you suggest some possible specific educational activities in the psychoanalytic institutes regarding the aged patient's treatment?
This is a very good question, and I think that the different societies will provide their candidates with some kind of seminars, at least, about this specific area, against every prejudice and taking into account the reality of the profession today. So I think it will be up to them, to the societies, to the institutes, to decide how and when to prepare the candidates to deal with this new area. But I foresee it will become something absolutely natural for them.
So, I thank you very much.
Thank you to you, Valeria. These questions are and were interesting, important, and connected to the change of psychoanalysis in the today world.
Thank you.
Thank you.
Psychoanalysis is, at core, a relationship between a patient and an analyst, in which personal exploration takes place at any time in the life cycle. With 30 years of clinical experience with aging individuals, Dr Gabriele Junkers tells us about early life targets for therapy to support successful aging and the painful challenges of endings for patients and analysts.
Hello, I'm Gabriele Junkers from Germany. I wish to share with you some experiences that motivated me to bring the IPA Committee on Psychoanalysis and Aging of patients and psychoanalysts into being. More than 40 years ago, just by chance, I became one of the first psychologists in Germany who was working full-time with elderly psychogeriatric outpatients at a university clinic unit that had just been opened in Berlin. About 10 years later, having qualified as psychoanalyst, I was surprised to find that life seemed to end for psychoanalysts at midlife. Since 1920, I found very few articles in the International Journal of Psychoanalysis. This motivated me to publish most of them in the booklet Is It Too Late?, edited by Carnage. Until about 1970, elderly with psychic symptoms were just regarded as not approachable with psychotherapy, even less so with psychoanalysis. They were seen as too old, too rigid and unchangeable, as Freud described. It is important to mention how little focus had been given to the differences between those patients who had suffered from psychic illnesses over all their lives and those who, for the first time in their lives, during the process of growing older, begin to develop psychic symptoms. During the last 40 years of my professional life, working in the different fields of gerontology, psychoanalysis and institutional work, also with the elderly, I have learned the following. First, it is very important to have a look at the whole person, body and psyche, and its interchanges, especially somatopsychic influences that are normally neglected by doctors, having in mind Freud's Das Ich ist primär ein körperliches, the ego is mainly a bodily one. Second, As a consequence, I developed a special interest in the first and very early symptoms of dementia, such as Alzheimer's diseases. These are normally very difficult to diagnose because they develop in line with a character, the known and typical personality traits of a person. 3. When doing counseling for staff members of homes for the elderly, including demented people, it struck me how much they profited from my explanation of psychic functioning in terms of paranoid schizoid mechanisms and the use of transference and countertransference. I learned that psychoanalytic knowledge seemed to be very helpful for their work. Once one said, "I work as usual, but I feel so much better, so different, because I can much better understand now the behavior that I was unable to understand before the seminar." 4. In my psychoanalytic practice, I was struck how much many elderly did not just get relief from psychotherapy, but more so how much they profited from psychoanalysis proper. It is not the material of a whole life that is too much to be worked through, as Freud stated in 1905. I experienced how much the very early relational problems with primary objects are the main targets to work on when they are reactivated during the process of psychoanalysis and repeated under the conditions of aging. 5. The ending and weaning when having experienced an analytic process is the most difficult and painful, and has to be worked through carefully. It is a last goodbye and a goodbye forever. 6. The most painful experience during this work is growing older as psychoanalyst. Having talked about problems of getting older for decades is something very different from experiencing it oneself, myself. 7. Especially the last goodbye to the last patient of my professional career, for which we as psychoanalysts have to decide one day, seem to be for some just too painful. The result is, for the patient or a candidate in training, the internalization of an analyst who cannot separate, who stays dependent, and even might deteriorate so that patient or a candidate are made into a mother or father to care for them. The tragedy of feeling unable to terminate, I described in the reader The Empty Couch, a summary of more than 30 years of experience within the analytic world. I hope I could motivate and encourage you for the work with elderly and make you a bit curious.
Professor Martin Teising of Berlin's International Psychoanalytical University has been addressing some of the most disturbing and challenging issues of late life in his ongoing multidisciplinary academic research.
My name is Martin Teising. I'm a member of the IPA Committee on Aging of Patients and Analysts and its European co-chair. I enjoy the work in our international committee under the leadership of our chairman, Audrey Kavka. I'm past president of the German Psychoanalytic Association, and currently I'm the president of the International Psychoanalytic University Berlin and a European representative on the IPA board. Since 1985, I'm a member of the Working Party on Psychoanalysis and Aging in Germany. In these last 30 years, we have demonstrated through close examination of many case studies that psychoanalysis is possible and very helpful with elderly patients. Our studies include the special transference and countertransference reactions in the relationship of elderly patients and younger analysts. Living means aging, and living means being dependent on one hand and striving for independence on the other hand. The struggle is to accept the fact of remaining dependent belong to the human condition. As a researcher in the field of psychoanalysis and aging, I am especially interested in the phenomena of dependence, which appears in old age as a tremendous endeavor for the individual as well as for an aging society. Starting with suicide research in the 1980s, I have been working to develop a psychoanalytic death understanding of the high suicide rates in old age, especially of elderly men. This research has turned me to focus on the meaning of narcissism, male gender identity, and psychoanalytic concepts of boundaries. I continue to work with multidisciplinary researchers to understand and even to prevent suicidal ideation in old age. I strongly support the inclusion of the developmental view of the full course of life as an essential part of psychoanalytic curriculum. I am proud to be a member of our committee working on all these issues in an international cooperation.
Aging is a concept used in everyday language, and yet it appears to be in need of a clear and functional definition. Having committed years of study to the midlife period of the life cycle, Dr. Guillermo Montero encourages further research in order to develop theoretical foundations for the study of aging within psychoanalysis.
Aging is a biological process starting at the very beginning of the human life cycle. But psychic aging, important for the scope of this committee, has to do with midlife aging till death. Midlife is mostly understood as a fairly imprecise period encompassing 25 years, say 40 to 65 years old. But this extended span of years has a very important psychic zenithal point around male and female climacterics. In order to precise and highlight subtle features, I pose the concept of maturescence to understand and explain the psychic transformations and decay of reproductive instinct, not only for women but also for men, even beyond their intrinsic differences. These psychic transformations usually imply a drive increase, formerly described by Freud in his writings, which had different paths of working through related to complementary series, personal history, predominant defensive mechanisms, identifications, and so. These vicissitudes open psychoanalytic theory towards a true metapsychology proper for specific maturescent psychic processing. In this way, maturescence becomes an important research target for this committee.
We end with Dr. Audrey Kavka, the chair of our committee, who addresses common misconceptions about aging that have stood in the way of psychoanalytical engagement with the entire life cycle. In doing so, she speaks about lifelong growth and development, about reworking through the psychoanalytical process, and about the richness of possibilities for psychoanalytic engagement with late life.
Hello, I'm Audrey Kavka, Chair of the International Psychoanalytic Association Committee titled Psychoanalytic Perspectives on the Aging of Patients and Psychoanalysts. I'm standing here in a vineyard just to make a couple points. Most of us know that mature vines are more likely to produce rich wines with interesting characteristics. I can tell you from my own experience how complex, rich, and satisfying it is to work as a psychoanalyst with late-life issues and late-life patients. The vineyard is also a visual reminder that life is about growth and development. Year after year, something new develops from what is already established. That is the life cycle of the vine, and it's also true for aging. Internal growth and development are truly lifelong. Sometimes what is new for the late-life individual is the formation of a meaning-filled relationship with the analyst and the newness of the analytic endeavor. Time takes on new significance in late life, and engagement with the inner world takes on greater significance as changes take place in the body, in life activities, in social and professional roles and relationships. Old relationships, those in the present and those internalized from the past, also become new as unconscious fantasies and representations emerge and are reworked in an analytic process that offers opportunities for living life with new vitality. The work of our committee is to promote further research, education, awareness, and clinical engagement with late-life patients and late-life issues. The time is right for turning your attention to these issues. The age demographics of the world around us are dramatically shifting towards late life. Worldwide, life expectancy is on the rise, and the over 60 population is the fastest growing age demographic group. In the U.S. alone, it is projected that in the year 2030, almost 1 out of every 5 individuals living in the United States will be over 65. We are a profession that values maturity and the wisdom of experience. Our patients are aging on the couch, and we are aging in the chairs sitting behind the couch. It is our responsibility to tend to the aging of our patients and to our own aging. As psychoanalysts, we cannot treat aging, but we can treat aging patients. Let's continue to study and learn from ourselves, from each other, and from our patients.
Aging is about all of us. We all age in unique ways, and yet the march of time is something that affects us all and is essential to the human experience. Individual analysts and psychoanalytical societies who engage with the issues of aging, including late life, will find challenge and opportunity there. Aging hasn't often been a priority within the psychoanalytic community, but an expanding focus on aging is possible. All psychoanalytic endeavors share a belief in change and transformation. The IPA leadership supports a change towards a fully inclusive attitude towards the field of aging studies. We hope this video will bring out further discourse, study and engagement with the issues of aging. Thank you for watching.